I want to take you through a new patient, her health history, what I heard as she and I were speaking during our first consultation, to give you an idea of how we think about health, how we think about trying to help you, how we think about trying to get to the root cause, and what so many people go through in which is unfortunate in our conventional medical system as far as clinicians who aren't thinking with root cause, aren't thinking with why and does this make sense, and listening to their patient and realizing the patient has no good reason to make up being miserable and feeling what they're feeling, and that there's likely a reason underlying their symptoms. So this young woman is in her mid-30s, and I'm just going to look down at my notes for her complaints because there were many. She had actually had what's called an endoscopy back in 2023, so only a year ago, and it was negative. It was perfectly fine. Now, what prompted that was that she's had a lot of pressure in her stomach. She feels full. She's bloated. She's recently, in the last 6 months, she can't relax. She feels short of breath. She has heart palpitations. She has a lot of anxiety. A lot of that is coming from pressure she's feeling in her head, pressure over her eyes. It moves around her head. She has pins and needles in her arms and feels almost numb in her head at times. And that symptom is kind of worrying her and giving her a lot of anxiety. So, and brain fog. So all of the brain fog and the pressure in the head, that's been the past 2 months. The stomach pressure really kind of has worsened in the last 6 months, and along with the heart palpitations and the shortness of breath. So that's what she presented me with. And so what do we start thinking with? I left out a very important thing. It was just 2 days prior, she'd had an endoscopy that showed a 2 centimeter, which is a small hiatal hernia. So we know that her stomach has compressed and had enough pressure pushing up to sort of, at a small amount, 2 centimeters, widen that opening of where her esophagus passes through her diaphragm. So that's the definition of a hiatal hernia. Now, her doctor very quickly said that none of her symptoms could have anything to do with this hiatal hernia because it's so small. That is untrue, but one hears it a lot from gastroenterologists that don't understand this problem. Now, she also has a primary care doctor who she said she has a very good relationship with. She herself is a student going into the medical field, so she understands the anatomy of things. As a matter of fact, as we talked, she got a little teary. She's like, I know this anatomy. I've been studying this. She goes, that makes sense. But anyway, getting back to her primary care doctor, the stress of this and this feeling of anxiousness was really sort of trumping all these symptoms that she had, even though she was miserable with the shortness of breath and the bloat and the fullness, etc. So her primary care doctor said, I don't know what to do for you. I think you just need to de-stress. And so what the patient responded, she says, I know what a stressful life is. I had a period of time where I was going to school evenings and weekends. I have children. I'm caring for them. It was a stressful couple of years, and I know what a stressful life is. That is not my life right now, yet I'm feeling this anxiety and sort of depression associated with this anxiety because of how my body is feeling. And her doctor said, I don't know what to do for you. Why don't you see a therapist? So she saw a therapist, and the therapist's response was, sometimes you just need to be depressed. Sometimes you just need to be anxious. Like, that's what life is bringing you, and you need to embrace it. Now, I'm not going to qualify that that's always bad advice. But in this particular situation, it absolutely is, because I've met a lot of patients who have said, listen, I'm an anxious person. I've been anxious most of my life. I get it. I know what that feels like. But then, and I'm sticking with hiatal hernia syndrome, but then they're quick to say, this is different. This isn't my typical anxiety, or this isn't my typical depression. This is different. I feel it. I feel like it's related to my gut. You know, people are intuitive. It's, you know, it's your body. You know it very well. And so I hear that a lot. So this patient, you know, she was getting back to this new patient. She was crying. She goes, and I'm trying not to cry because I feel it makes the pressure in my head worse, and I don't know what to do, and I keep going to the ER, and they don't know what to do, and my doctor just gave me a hug at the end of the visit, and I felt so unheard, you see. So we discussed how what happens with hiatal hernia as your stomach compresses and gets pushed up, it runs into your diaphragm, which is the muscle right above your stomach. They're very close to one another. They shouldn't be jammed up upon one another in a normal circumstance. There should be movement, there room for the diaphragm to move, but with hiatal hernia, it's sort of jammed up against that diaphragm, and the diaphragm's kind of stuck. It can't move freely, floating up to 5 inches the way it should. And then what happens is your nervous system is aware of, gee, there's not quite enough oxygen, and it goes into fight or flight. And that's when you're feeling anxious, even though the environment, the external environment, doesn't warrant it. And that's what we think about, right? If you get this overwhelming feeling of like doom, and all of a sudden you're short of breath and your heart's palpitating, you're kind of looking around your environment saying, well, what's up? What's happening, right? And when there's nothing that warrants it, you think, what's happening to my body, and why? Am I having a heart attack? You go to the worst case scenario, and of course this woman had already been to the specialist, and there's nothing wrong with her heart, and there's nothing wrong with her lungs, et cetera, et cetera. So instead of saying, well, you just got to feel what you got to feel, and sometimes you're going to feel anxious in life, how about we look at everything going on with this woman's body and say, why? What is really the root of this, and could it be connected? Shortness of breath will push you into fight or flight, and you will feel anxious, and it's a scary situation. An elevated stomach and diaphragm can cause heart palpitations, and then you wonder if you're having a heart attack. We know this cascade of events. Now let's go back again. This patient was telling me this all started for her last summer. So I'm filming this, it's November 2024. She said last summer, starting in June, she had a urinary tract infection. She got put on antibiotics, and then subsequent to that, she got a vaginal itchiness, or a yeast infection, which very common post antibiotics, unfortunately. Then they put her on 2 more rounds of antibiotics to handle that. So 3 rounds of antibiotics in a short period of time, and she goes, I have not been the same since. Like, this just really messed me up. So she had that as her sort of line in the sand of where things shifted. And that's fine, because we know antibiotics really will annihilate all the good organisms in the gut and inflame the gut even more. But what I know to be true is that even a small hiatal hernia, that 2-centimeter hiatal hernia, those don't develop that quickly unless there's some trauma. Maybe you're vomiting intensely or coughing very intensely for weeks and weeks and weeks and weeks. There are things that can bring it upon you sooner, but typically it's something that happens over time. So then we went back in time, and I'm like, have you ever had constipation? Oh, I've had chronic constipation my entire life. Okay, now we're talking. Have you had any acid reflux? I've had chronic acid reflux most of my life. I've taken Tums. I've taken over-the-counter medication. Okay, so now we know that pre those antibiotics, we were already in an environment where we had a slow-moving colon, meaning inflammation in the digestive tract. We already had acid reflux, so the stomach was already being compressed by this intra-abdominal pressure. That was already there. Then the antibiotics, now it makes sense that they sort of just blew everything up to that level where now she's short of breath and has heart palpitations and anxiety, you see? So Now it makes sense. And that's how we work here at Root Cause Medical Clinic. It's like, tell me the story. Tell me the story. It has to make sense. And I'm always digging. And that's, our programs are very personalized and customized to the individual, because each of us got to where we are due to a different route, whether it's what happened to you in childhood, a lot of antibiotics, or you had a terrible diet, or mom was really unhealthy, so you didn't get the healthiest microbiome from her. There's genetics. I mean, you can go all the way back, but it has to make sense, and then we understand the systems that we need to strengthen and empower naturally to turn this around. And then I also explained to her about the vagus nerve and how it wraps around the bottom of the esophagus like a web, and as all that pressure of the stomach and diaphragm pushes up, it irritates the vagus nerve, and you can get moodiness, you can feel pressure in your head, you can get the pins and needles, a lot of different symptoms associated with vagal nerve irritation. So that was the nice little package that we wrapped it up in, that to make sense of how she got there. And it made a lot of sense to her, and she was crying happy tears, because somebody was actually listening and making sense of her symptoms, other than telling her, you got to live with it. This is life. This can happen. And yeah, life can be tough, but there's a lot of things, in my opinion, you don't need to live with if somebody can help you get to the root cause. That's what we do here at Root Cause Medical Clinic. And if you want our help, we are delighted to be here for you.